Today we will discuss heat strokes, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Heat stroke is a serious condition that occurs when your body becomes too hot, usually due to prolonged exposure to high temperatures or strenuous exercise in hot weather. In simple terms, it's when your body can't cool itself down anymore, leading to a dangerous rise in body temperature. Signs of heat stroke. 1. High body temperature, a body temperature of 104 degrees or higher. 2. Altered mental state, confusion, agitation, slurred speech, or even loss of consciousness. 3. Hot, dry skin. You may stop sweating, and your skin may feel hot and dry to the touch. 4. Rapid heartbeat. Your heart may race as your body tries to cool down. 5. Nausea or vomiting. You might feel sick to your stomach. 6. Headache. A severe headache can also be a symptom. What to do? If you suspect someone has heat stroke, it's important to act quickly. Call emergency services. Heat stroke is a medical emergency. Move to a cooler place. Get the person indoors or into the shade. Cool the person down. Use cool water, wet cloths, or ice packs on key areas like the neck, armpits, and groin. Hydrate. If the person is conscious and able to drink, offer cool water or sports drinks. Heat stroke can be life-threatening, so it's crucial to get help immediately if you or someone else shows these symptoms. To recap, if someone has a heat stroke, here's what to do in simple steps. 1. Call for help. Dial emergency services, like 911. 2. Move them. Get the person to a cooler place, like indoors or in the shade. 3. Cool them down. Use cold water or ice packs on their neck, armpits, and groin. Wet towels can also help. 4. Hydrate. If they're awake and can drink, give them cool water or sports drinks. 5. Stay with them. Keep an eye on them until help arrives. Act quickly. Heat stroke is serious. In the hospital, here's what doctors and nurses do to treat someone who has had heat stroke. 1. Cool them down. They may use special cooling blankets or ice packs to lower body temperature quickly. 2. 4. Fluids. They give fluids through an IV to help rehydrate and stabilize the person. 3. Monitor vital signs. They check heart rate, temperature, and breathing closely. 4. Medications. They may give medicines to help with symptoms like pain or nausea. 5. Support. They provide care and support until the person is stable and improving. The main goal is to lower the body temperature and prevent complications. In cases of heat stroke, specific medications may be used to manage symptoms and complications. Common examples include 1. Intravenous fluids. While not a medication per se, IV fluids like normal saline are crucial for rehydration. 2. Acetaminophen, Tylenol. This may be used to reduce fever and relieve pain. 3. Ibuprofen, Advil, Motrin, another option for lowering fever and reducing discomfort. 4. Benzodiazepines, medications like lorazepam, Ativan, may be given if the person is agitated or having seizures. 5. Electrolyte solutions, sometimes used to help restore electrolyte balance. The choice of medication and treatment will depend on the individual's condition and the healthcare provider's judgment. Always follow medical guidance in these situations. 1. Elderly people. Older adults often have a harder time regulating their body temperature. 2. Young children. Babies and young kids can overheat quickly. 3. Athletes. Those doing intense exercise in hot weather are at risk. 4. Outdoor workers. People who work outside in the heat, like construction workers, are more vulnerable. 5. Overweight individuals. Extra body weight can make it harder for the body to cool down. 6. People with certain health conditions. Those with heart or lung issues, or who take medications that affect heat regulation, are at higher risk. 7. People not acclimatized to heat. Those not used to high temperatures, such as travelers or newcomers to hot areas, can be more susceptible. Being aware of these factors can help in taking precautions during hot weather. Now you need to watch my video on alcohol withdrawal or have a look at seizures.